Good evening, friends. I'm Dr. Ajay Shah, and tonight's live is about high blood pressure. Yesterday, I did one segment on high blood pressure, so please watch it if you have not watched it. And today, we're going to go to segment two, and total there will be 10 segments on high blood pressure over next 10 days. Today's topic is how to measure your blood pressure. Measuring blood pressure has been around for 100 years. We used to measure blood pressure in doctor's office traditionally, but now with the availability of a simple home measuring devices, you can actually measure your blood pressure at home. There are Amran type device. There are many other companies. Even Walmart makes one, and those devices are very cost effective. Matter of fact, you can buy a device for only about 35 to $45, and it's very simple. Typically, you would buy one with the arm cuff, where you put your arm into the cuff and just press a button on that automatic machine, and it will measure your blood pressure. I prefer the arm cuff. I don't recommend wrist cuff, or I don't recommend any other cuff actually. I prefer arm cuff. If you are a big size person, make sure you purchase a large arm cuff so that way it fits on your arm. It's very simple. You can actually buy it, at any pharmacy, at any department store, even Walmart or any other place where they sell medical appliances. So again, I highly recommend to buy a arm cuff to keep track of the high blood pressure. Matter of fact, now I recommend all my patients to have blood pressure measuring device at home once they hit about age 35 or 40. And you should take your blood pressure. If you have a history of high blood pressure, you should take your blood pressure at least once a week, preferably 2 or 3 times a week. If your blood pressure is running above 120 over 80, try to take your blood pressure every day. And then we will talk about how you can lower your blood pressure with lifestyle changes. That will be a segment tomorrow. But first thing is to start measuring your blood pressure at home. If your blood pressure is below 120 over 80 at home, you don't have to check it every day. You can check it probably once or twice a month, but make sure you keep track of your blood pressure. Many of these devices actually have a memory function, and it can track your readings over like 20 or 30 readings. But I actually highly recommend to have a simple notebook where your machine sits, or even writing it down on your phone in a note function or note app. I measure my blood pressure at least 4 or 5 times a week. My blood pressure runs typically between 105 and 120, which is pretty excellent. My blood pressure used to be 140, 160 range 5 years ago. Since then, many of you know I lost about 50 pounds. I don't eat any more salt, and my blood pressure is in excellent range. I want all of you to have blood pressure below 120 over 80. So measuring blood pressure at home is very important. When you measure your blood pressure at home, let me give you some guidelines. You can write it down, or you can watch this thing on YouTube. It will be available tonight. But write down this guidelines or these instructions when you measure your blood pressure. So, like I said, have one with the arm cuff. Do it in a sitting position. Do it in the right arm. So again, sitting position in the right arm. No smoking for 1 hour if you are a smoker. Obviously, quit smoking if you can, but no smoking for 1 hour. No cross leg. Keep your legs straight and keep your legs supported on the ground. No layers on the arm, no sweater, no shirt. Just have it with the bare arm, the cuff on the bare arm. No talking while the blood pressure readings are going. So be quiet and just let the blood pressure machine take your blood pressure. Take two readings and then average out those two readings. Have a proper back support, so don't sit without any back support on the chair. Keep the blood pressure machine at the heart level. So typically, I do it my blood pressure check on a dining table where I'm sitting on a supported chair, and the machine itself is sitting at about my heart level. Um, um, No caffeine for 1 hour if you can avoid it. I typically take my blood pressure as soon as I wake up in the morning before I have any coffee or any other stimulant. So try to take your blood pressure first thing when you get up in the morning. Traditionally, the blood pressure is highest in the early morning hours. So if your early morning hour blood pressure is normal, 120 over 80, you can be assured that your blood pressure will be normal throughout the day. But I highly recommend taking blood pressure on a regular basis with an automatic machine. Obviously, when you go to see your doctor, you also will be having high blood pressure check, particularly if you go see your primary care physician. So take your machine with you so that way you can correlate whether your machine is accurate or not with the machine at doctor's office, or if the doctor is taking manually, or if the medical assistant is taking it manually. So I would highly recommend that whenever you go see your doctor, take your blood pressure machine with you so that way you can correlate and you can actually calibrate to see how your machine is doing at home versus how your doctor's office is doing it. There's also another thing to remember that many times in doctor's office, the blood pressure can be high because of anxiety, because of many of the reasons. We call it white coat high blood pressure because doctors wear white coat, and many times going seeing a doctor raises your blood pressure. That itself is abnormal, but many times as long as the blood pressure remaining hours of the day is normal, we can just watch it. And only way you would know that you have a white coat high blood pressure is if you take your machine to your doctor's office, your doctor checks your blood pressure, and the machine matches it. Then you know that machine at home, when it reads normal, that your machine is accurate and you are having the healthy reading. So again, always take your blood pressure machine when you go to see your doctor's office and try to match it, try to calibrate with your doctor's reading. Um, Now there are some watch type device available. Matter of fact, I have one. They're not very accurate. They're fair in terms of trends, and I think it's a moving technology. I think one day we will have a watch based blood pressure equipment. I'm waiting for that thing to come out in a very accurate way. I own one, but I know many times it doesn't match the readings at doctor's office or reading on my regular arm run arm cuff itself. So I right now I don't recommend to buy a watch to measure the high blood pressure or follow the blood pressure. Uh, there is also another device called ambulatory blood pressure monitoring, where you wear a device and you have a small measuring machine which stays on your waist, and it measures the blood pressure all 24 hours, every 3 to 5 minutes, and it gives you average reading for throughout the day. It also gives you the spikes throughout the day. It also gives you the lowest reading throughout the day, and it's called ambulatory blood pressure monitoring. Insurance covers it, medical covers it. If you have a white coat high blood pressure, means doctor's office high blood pressure, your insurance will cover it. But you can just simply have this automatic Amran type blood pressure machine at home costing only 35 or $40, and you don't have to have that ambulatory 24-hour blood pressure monitoring done. I used to own that kind of equipment in my own practice, but now I typically don't use that device. I just ask patients to measure the blood pressure at home. If you go to a pharmacy, many pharmacy have now blood pressure kiosks, and you can actually sit and measure your blood pressure at the local pharmacy. I highly recommend to keep track of your blood pressure on a regular basis, particularly if you suffer from high blood pressure and if you are trying to reverse the high blood pressure with lifestyle changes. So that way, as your blood pressure starts coming down, you can start cutting down on medications. We'll be talking about what things you can do to reverse your high blood pressure and how you can get off the blood pressure medications over the next 3 days. So tomorrow, day after tomorrow, and day after that day is actually 3 days I'm going to be dedicated towards how to reverse the high blood pressure without taking any medication. So please stay tuned over the next 3 days if you have a high blood pressure, particularly if you are interested in reversing the high blood pressure without taking any medication. I hope today's live was useful to you. Please have comments. Please have comments. Please have your questions. I will answer those questions and comments tomorrow. Yesterday, we had a question about beet, using a beet juice or eating beet. I agree that helps with the high blood pressure. I'll be covering some information about the beet over next 3 days. There was also another question about whether blood pressure needs to be at what age we should start monitoring blood pressure. I think anybody above age 20 should know their blood pressure at least once a year, and if they have a high blood pressure, then they should know their blood pressure once a week or more often. I highly recommend to own a 35 or $40 arm cuff blood pressure machine to all the adults. I have it. All, my brother has it. I have recommended to all my friends, my family, and I highly recommend all of you who are watching this video. This video will be on YouTube tonight, so you can watch it again and again. Please share this video on your page if you think it will help your friends and family. Please like, please have a comment, please have questions, uh, and subscribe to our YouTube channel. Thank you and have a great evening. I'll see you tomorrow at 9 o'clock. Thank you.